Good morning, I'm Marcus Boston and I am a birth trauma attorney. In other words, I represent babies who have suffered a traumatic brain injury at birth, namely HIE, hypoxic ischemic encephalopathy, and their parents. And what I would like to discuss this morning is an issue that I am so glad is finally beginning to get on the national stage, and people nationally are beginning to talk about this. And this video is going to focus primarily on Black women, African American women in this country giving birth. And so what is the statistics? What is the research? What are the studies beginning to show? It's showing that Black women are dying more than they're dying at a higher rate than any other group of women when it comes to giving birth or around childbirth. The Black mother mortality rate in this country is higher than anyone else. And so now that we're looking into it, now that studies are coming out, what are they finding? They're finding a lot of things. And what I would like to talk about today are two things that are being looked at and that also tie into babies that suffer traumatic brain injuries at birth. And so a lot of this research, even information from the CDC, Centers for Disease Control, we are beginning to see that yes, racism, structural issues are problematic in medicine. And we have known this. I mean, this has been going back in time, even, going as far back as to how Black people in general were viewed in this country. Supposedly a higher pain tolerance and all of that type of rubbish. But what we're also finding is that for Black women, a lot of times doctors are not, number one, paying attention to Black women. They're not paying attention to them either during labor and delivery or after, when they have given birth. Number two, the second one is doctors and nurses not listening to the mother's complaints. The big one for this, or the one that caught a lot of people's attention, was Serena Williams. It was the same thing with her. And so now we're at the point of this video where I want to tie these two issues in as a birth injury, as a birth trauma attorney, what I hear talking to women. And I know the first part is I talked about Black women, but this second part, it also applies to Black women, but we hear these same concerns from white women, Hispanic women, Middle Eastern women. It doesn't matter. Some of these same problems also will seep over into the labor and delivery aspect of things. And what are they? What are some of the main things that we hear? Number one is that the doctors or the nurses are not paying attention to mom. They're not paying attention. And then number two, if they do come in to talk to mom about what's going on, they're not necessarily listening to mom's concerns about her body, how she's feeling, what she can do. One of the big ones that we hear is mom is saying either she's tired or things aren't going well, and the doctors and nurses, what are they telling her? Keep bearing down, keep pushing through. And these types of behaviors, they can be extremely problematic on the labor and delivery side for the baby, especially when that child is in a condition called fetal distress. And so I've talked in other videos, I've talked about the importance of the electronic fetal heart monitor, the role that monitor plays when it comes to labor and delivery, helping doctors and nurses understand in real time how well a baby is tolerating a vaginal delivery, whether there are problems with variability, late deceleration, or whether mom is dealing with tachycardia, in other words, problems with contractions. All of these things are being picked up by that electronic fetal heart monitor. And if you've got doctors and nurses either not paying attention to mom or not listening to mom, and that fetal distress goes on, and other types of remedial measures, conservative measures, they're not working, turning mom, moving mom, giving her a bolus, all of these types of things, oxygen, these things aren't working. And that fetal distress goes on for too long. What it can cause is a baby to have issues with blood and oxygen. The baby can have a reduction in blood and oxygen. If you've got that reduction in blood and oxygen going on for too long, then what can happen? the baby can suffer a brain injury. And in our context, I'll come back up to the beginning, that HIE word that I mentioned earlier, hypoxic ischemic encephalopathy, in our context, that is a reduction in blood and oxygen, which can lead a baby to suffer a brain injury. And so when doctors and nurses, they're not paying attention to mom, letting fetal distress go on, not doing adequate remedial measures, or not moving to an emergency C-section when warranted, then of course that baby can suffer a traumatic brain injury. Now, what can mothers do on that labor and delivery and on that pregnancy? What can moms do when it comes to all of this? What I would say is, when you first find out that you're pregnant, what you want to make sure that you do is you do your research on your medical provider or your medical professional. Nowadays we got the internet, we've got Google, we've got reviews, we've got ways to do our homework and to see if these professionals, if they fit, if they are a good fit. What have other mothers or other families have said about their interactions with that medical professional, that doctor? That's number one, do your homework. Number two, what you also want to do is you want to make sure that you research your hospital. That hospital, make sure you do the same thing, do your homework as to the hospitals that are in your area, or where you may, if you're going to give birth in a hospital, do some research as to that institution. Make sure also that that is a good fit. Reviews and online information about that hospital, that is critical. Number three, what you also want to do is you want to have goals in regards to your pregnancy. Think about what you want to accomplish, how you want to move through your pregnancy. That is also important. And number four, when it comes to labor and delivery, comes to coming to the hospital, make sure, if you can, that you have an advocate with you. That is either, that can be a family member, that can be a friend, but make sure that you have a person that is there with you, that also understands your goals and can also advocate for your position. I know I talked about a lot in this video, and from racial issues to structural issues, I know I talked about a lot, but I'm trying to give insight into these issues, these critical issues. Me as a black man married to a black woman who's also my partner in here, Renee, and having access to her friends and the women that she's involved with. This is eye-opening information, and it is refreshing to see that this information is finally being pushed to the forefront, and people are finally discussing these issues when it comes to black women, black families, and also babies and families in general. If you have more questions about your situation, I am a birth trauma attorney. Now, I don't really handle the wrongful death aspect of things. We handle mostly the birth trauma. If you have questions about your baby's traumatic brain injury at birth, maybe you're watching this video because your baby has suffered a traumatic brain injury, an HIE concept that I talked about earlier, or maybe you have not only an HIE, but a subsequent cerebral palsy diagnosis that you're dealing with. Maybe you have questions about this, and thinking back through doing your labor and delivery, maybe the doctors and the nurses, they were not paying close attention to you, or they were not listening to your concerns. And maybe the electronic fetal heart monitor was showing that your baby was in a condition called fetal distress, and the doctors either didn't move to an emergency C-section fast enough, or they just didn't even do one altogether. If you've got these types of things going on, what I invite you to do is to go ahead and pick up the phone and call me. There is a telephone number on the screen, and I would be glad to take some time and listen to your baby's story. When you call my secretary and you want to get on our calendar, make sure you pick a date and a time. That is important. A date and a time so we can know when to get back in touch with you. One more thing before I get out of here. I practice law in the state of Maryland, and I know that this video is on the internet, it's on social media, it's on other places and platforms, and I cannot necessarily control who's going to call me. If you do call me and you are not in the state of Maryland, please understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can help work with you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you're not in the state of Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.